This is The Philanthropy Show, connecting and inspiring philanthropy.
Welcome to The Philanthropy Show. I am your host, Luann Saraga-Walters. Sometimes in your community, you have a great thing happen. A new foundation comes in, or it gets a new lease on life, or there's just new opportunities for doing great new things in your community. And we had one of those things happen a couple of years ago in the Tampa Bay area. But there's a little confusion around it because we're not quite sure what the foundation does. So today, we're going to solve that question, and we've got a very special guest with Randy Russell, who is now the new president and CEO of the Foundation for a Healthy St. Petersburg.
That's right.
Welcome, Randy.
Thank you.
Nice to have you. And just so that people understand what this show is, it was formerly called the Bayfront Health Education and Research Organization, otherwise kind of acronymed HERO. So, but no longer. Now we are the Foundation for a Healthy St. Petersburg.
That's correct.
And a standalone organization.
That's correct.
In the first segment, what I like to do is to get to know you. You've come down from Seattle. It's a big transplant for you. But there's also this confusion about the foundation and what it's established to do. So in brief, well, I guess let's start with the foundation first, and then I want to come back into how you came into St. Pete, because it's fun to have new people here as well.
Well, terrific. Thank you so much. I'm delighted to be with you. So Conversion Foundations started 25 years ago, and the concept was that when nonprofit hospitals who'd been around for 100 years or so began to really struggle financially and needed infrastructure investment and capital investment, for-profit systems began to buy these nonprofit settings. When that happened, the proceeds from the sale established a foundation. So they're called Conversion Foundations. So here in St. Petersburg, the Bayfront Medical Center systems sold in 2013, and the profits from that sale set up this foundation. So when the hospital is now a part of a for-profit entity known as Community Health Systems, and the foundation is a completely separate animal that was born out of the hospital's history, but has its own focus and purpose and its own mission that is separate completely from the hospital.
And that's a big point, because I think there's a little confusion here in the Tampa Bay area that it is not the foundation of the hospital.
No.
Okay.
There, a for-profit hospital could not really have a foundation to raise money for itself because it's a for-profit entity. So, when the hospital sale occurred, that option left the business model of what the hospital operates under.
Well, there's a lot of fun stuff with that because you're starting fresh. You have a lot of areas that you can go into. But now that we've got that part kind of taken care
Clarified.
of, let's find out about Randy. So welcome.
Thank you.
It's fun. I first heard once it was announced that Randy was coming in from Emily Benham, because you two have known each other for decades.
Yes.
And she was so excited, and the fact that we value and respect her opinion so much was fun to have you come in. So
That means
tell me
a
a
lot.
little
Thank you.
about your background and where you've been coming down from Seattle.
So I'm sort of in a third career, and these days we don't have jobs for 30 years or 40 years anymore. So I started
Right there with you.
I started as a musician and was a professional musician, and then moved
Fabulous.
into orchestra management. So for the first 15 years of my career, I was either playing or doing orchestra management work. So
What'd you play?
I was a bassoonist.
I played bassoon in 7th grade.
Did you really?
I knew I liked you.
There you go.
Let's go, Weed family.
Double
That's right.
reeds, they're our friends. So that sort of world introduced me to the nonprofit sector and how it worked, because I did a lot in orchestra management. So I was a marketing and PR guy, and I also raised a lot of money for orchestras and worked in a bunch of different cities in the U.S. When the HIV crisis started, I really began volunteering quite a bit, and I began to ask myself the question, is promoting predominantly Eurocentric music through an orchestra really what I'm here for? And there became to be this inner calling to do something a lot more meaningful for me anyway. So I tell the story that I got into the nonprofit sector because of music and found my purpose and meaning in it in terms of the work with HIV. So from 83 to 89, I had 45 buddies, all of whom died.
Wow.
And that really sort of dramatically shaped me and how I thought about the world. And then in 1990, went to work professionally in the HIV world and went back to school, got a social work degree. So I'm a proud MSW social worker. But really think in terms of systems, macro systems. And what HIV did was really integrate sectors in ways that we hadn't asked ourselves to do this before as a nation, or as frankly also globally. Because it's chartered questions for us about our spirituality, about how we care for one another, about poverty, about distinction of sexuality and what that meant, and all of these taboo topics that were really hard to talk about. HIV just brought them right out of the surface. So it was an amazing journey to watch this country's response, to watch our medical advancements and what that can mean. And it has me convinced that nonprofits can really make a lot happen for a lot of people in need.
That's really interesting that you see that connection too, because I think, it's part of our history.
Yeah.
And we're used to seeing it as, well, this happened and then this happened, but that you're seeing the thread that's pulling everything together from that crisis.
Yeah.
That I like the way you're thinking with that.
It's a systems approach, really, and the understanding in this world. In today's philanthropic sector, we're all wondering about impact and having some kind of consequence to the positive occur. So data is a big push. What data are you collecting? And sort of triggers between social science and which has its own rigors and its own expectations, but that's distinguished from hard science or random controlled trials that medical professionals often think of, and so they sometimes poo-poo social science. The reality is we can measure impact. We know how many people were smoking, we know how many people stopped smoking just based on volume of sales. There's lots of data points that can really help us tell a community's health story. And so when you have an opportunity of a foundation like this that is thinking about community health and population health, that's what HIV did. So to be able to do that across various conditions that have a lot to do, the social determinants of health construct, is really what the foundation is operating through. That lens is what we're operating through. So all the various things that lead to a healthy person, spiritually, physically, mentally, where you live. We have predictors about kids who grew up in poverty with single heads of households and their likely outcomes from a health point of view and why that is. It's not because they're less than.
We're studying it as the whole person.
Right.
As opposed to just
Right.
where they live or just where they work
Right.
or how much money they have.
Right, and we've tried the approaches of the individual interventions. My most recent example of this is in California, where for 10 years they funded to several $100 million, to the tune of several $100 million, the construct of having removing all junk drinks from high school with the thought that that would really delay and reduce the number of diabetics of that age group who were diagnosed. And in 10 years of abstaining and pulling these colas out and sugary fruit drinks out, there was not one bit of change. So behavior change doesn't happen from removal of a stimulant or a product that is bad for us. We learned that with cigarettes as well. And behavior change is more than knowledge.
Because behavior is not about just in this one location.
No.
They may not for these few hours that they're here, but there's
That's right.
the rest of the behavior, the rest of the...
That's right.
So you were at, I'm finding it. In Seattle, you just came from the name of the organization.
Lifelong. So Lifelong was born out of HIV disease. So I ran 2 nonprofit organizations that were HIV specific, did a lot of consulting work in a lot of various states. And the last role I had was in Seattle, and that was a 4-year stint. This is an organization, a $30 million nonprofit that had some tremendous programs, and the pivot of the Affordable Care Act was fully taken advantage of in Washington State, and that's why I went there. I wanted to see how this was going to really work.
Wow.
So it was a fascinating experience, and we took all 60 HIV case managers that were statewide, included them in the pool that navigated all the folks who had just gotten coverage. Those case managers took the hardest to serve folks and got them connected. So we had 15,000 folks referred that got connected to care through that network. So now HIV is mainstream. That's always been the wish and the dream, that it doesn't have to have a standalone system. So when that happens, then what does an HIV-oriented organization do? Well, we move to chronic illness. So while I was there, we changed our mission and broadened who we served.
Well, that's a parallel path.
Yeah, because how you care for someone with diabetes is not dissimilar these days from how you care with somebody for HIV or the elderly. There's a lot of geriatric care similarities.
It's nice when you know that there's the work of a nonprofit is actually affecting change to the point that they have to change what their focus is.
Yeah.
Right. That's success.
Yeah, and and because of the philanthropy show and the way you focus on these things, it's sort of an interesting idea to say, relevance, right? What is relevant? And it's really a challenge sometimes because most of us move into this sector because we're passionate. You know, this is my thing and I'm passionate about it. So it's really hard to stay objective and understand relevance because your agenda is what you're living. I've done it. I get it. I'm not judging it. But relevance now, with all the seismic changes that are happening systemically, you got to pay attention and you got to be willing to move.
That could be a class.
Yeah.
A couple of classes, I think, probably.
Yeah.
We're getting close to having to take a break, but I want to find out first how you came from Seattle to St. Petersburg.
Well, this is one of those things where you don't take a job thinking you're going to leave. You take a job thinking you're going to, stay. And that was pretty much the case in Seattle until I heard about this opportunity. And then it was like, I've done a lot in my career, and this ability to work systemically with a community. Saul Alinsky is one of my favorite folks in the world because of the community action and sort of real community mobilization that he used towards many different issues. And this opportunity gave me that chance to pay attention and think about how community leadership could work.
And as a community leader, you're now going to be kind of crafting where does the Foundation for a Healthy St. Petersburg focus? And you've got a kind of a broad path.
I do.
To look at.
But we're working on ways to solidify that.
Well, that's excellent. So we're going to take a quick break,
Right.
and we'll be right back with Randy Russell on The Philanthropy Show. More after the break.
Follow The Philanthropy Show on Facebook for behind-the-scenes action, polls, and commentary. This show sponsored in part by
My Paper Pusher. Consider it done.
The Philanthropy Show is on demand every Monday at 4 p.m. Eastern Standard Time at both thephilanthropyshow.com and YouTube/WatchMVVP-TV.
Welcome back to The Philanthropy Show, talking today with Randy Russell, the President and CEO of the Foundation for a Healthy St. Petersburg, which, we only say it one more time, was formerly known as, we know it as Bayfront Hero, but now the Foundation for Healthy St. Petersburg. Found a little bit about Randy in the first section, and now we want to talk. You're coming into this brand new organization, really. It's only 2 years old. So, with your foundation constructed, the name kind of gives it away a little bit, Foundation for a Healthy St. Petersburg. But what will you be focusing on? Does that mean healthy benefit overall, the overall being? Does it mean focusing on medical areas? What's your focus for the foundation?
So the board set, from the sale of the hospital a couple of years ago and the establishment of the foundation, the board spent its time doing two main things. One was setting up a mission, a vision, sort of a purpose, and getting clear, recruiting the right board because they had pivoted from the hospital, and then doing a search to find the leader. So during that time, that they solidified this construct of social determinants of health, which is big in and of itself. It's a big bucket. It could be housing, it could be jobs, it could be food programs, it could be a variety of different things. So it's everything outside of the doctor and the patient or the nurse and the patient. It's everything outside of that has to do with health. So how do you define that and how do you make it more clear?
That's pretty vast.
So there's two ways we're doing it. First of all, we're not presuming we know, right? So the first thing we're doing is listening. So we're doing 6 sessions of listening tours in the most impoverished areas of St. Petersburg.
Like a town hall meeting?
Like a town hall meeting.
Wow.
And these are at a variety of settings, like a recreation center, an elementary school, so that we get different segments of the population and really hear from folks on the ground. And we're asking them to imagine what is community health? What is what would make St. Petersburg the healthiest city in the nation? What would that take?
Wow.
And then we're going to ask them, where are you now? And then what do you need to get there?
That just sounds like fun.
Yeah. So 6 of those sessions, and then we're doing 3 sessions with social service providers who all work in this space, working with the impoverished. And then we're going to talk to the corporate sector who do corporate philanthropy.
Excellent.
And include, of course, the municipalities, the city and the county and the state input into this process. That picture will help sift through, the wide range of stuff. Now it starts to narrow. There's one piece we're missing. When you listen to need, we've got needs assessments and documentation out the yin yang. We're not going to start over from from how to do a needs assessment, but we are going to amalgamate all the data. It's sort of like a meta-analysis of all the needs assessments out there. Every hospital has to do one. The public health department does one. The mental health department does one. The housing programs, the homeless world does one. So how do we bridge those together and really get an understanding of the total picture? The piece that's missing is, what are the community assets and where are they located? So part of our funding principles will be, in the first couple of years, who's willing to work with the foundation in this collaborative way, and then where are you located, and are you located doing programs that the community says it needs?
And on that, really quickly, where is your focus? Are you Pinellas and Hillsborough? Are you Tampa Bay? Are you Sarasota? What's your...
South Pinellas, St. Pete.
South Pinellas, St. Pete.
Right,
okay.
right. So it's, it's not only St. Pete, but it's really, the Census Bureau really dictates that there's 5 zip codes in St. Pete that are somewhere north, between 10 and 17% of the population who live in these zip codes are living below the poverty level. So if you're a single person, you're living below $13,000 a year. So, that is the place we're going to start.
Okay.
That's the hardest place to get healthy, because the resources you have and the way, frankly, those communities are treated have combinations of things that block and put barriers up. We're really interested in pulling those away and finding the right interventions, targeted, focused interventions that help. So it's a bit of a demonstration project, because you take this global need, you look at the assets you have, and over the first 5 years of the foundation's life, we're going to narrow and narrow and narrow and try to figure out where's the right surgical spot.
Wow. Well, and that's also, you're talking about corporate collaboration, you're talking about governmental, you're talking about nonprofit, you're talking about in trying to find the assets and who's already developed those and wants to work together. And I think most people now are really looking at a collaborative process for that, you said impact, the collective impact.
And that sounds great. On the ground,
trying to get it,
it's really hard, and it takes somebody with intent. And one of the things that attracted me the most about this role is you can have the idea from a nonprofit seat, you can have the idea from a government seat, but it's really hard to galvanize from those seats because everybody presumes your agenda. If you're a foundation, benign, you can invite those people and convene conversations that don't have agendas, that just take the wisdom from those groups and find ways of partnership and collaboration.
So what is that process then? So you have your town hall meetings, your surveys. How do you then collect, how do you pick, well, here are some suggestions to make this a healthy St. Petersburg. What are the weighing factors that make you say, this is something that we would go with rather than this? You see where I'm going with that?
I do. We don't have those answers completely yet about the process, but I'll tell you the tools that we plan to employ, and those tools, I believe, will get us there. So the tools, one of which is the first round of funding, we're going to capture a lot of data from the applicants. What is your cost per service? Who are you serving? How do you define need? What do you see as a healthy community? That'll help us. So now we've got all this data. We are employing a panel or an academy, we're not sure what we're calling it yet, but an academy of experts, in essence, who are public health officials, who are disease specialists, who are program design evaluators, so that we have a way of external experts to help us sort through this data and really look at the problems. I think the process is not one that we can contain in our minds in a short period, because this is a 5-year march. So I give myself peace, because I get in the same conundrum you just talked about by saying, well, it doesn't have to happen tomorrow. We got to learn more. So the basic flow is what I'm talking about now. Of it's sort of, to me, the picture I have is you're sifting through all these needs, and some are really being addressed fairly well. Some are not.
Yeah.
Right. So it's organic. It's an organic process to get there.
Well, that's neat. Well, how do you determine who is invited to the town hall meetings? Is that per zip code or per area that you're going to be in?
So we're, the community engagement is one of those things that it's so simple and so rarely done well that I hope we were going to do it well. We are recruiting from those communities a captain whose responsibility is to help us recruit. I mean, how would I know who to invite to a community meeting? We have facilitators, an external facilitator who's going to utilize folks of the community who are also facilitating the meetings. And we're talking about we are going to provide an incentive of some kind that's about health. We don't know what that is yet, but a way to sort of honor and model that we're asking you for your time and expertise, and we want to thank you for it.
And
right?
Randy, these are community-wide issues that are going to be discussed.
Yeah.
So is this going to be, and when you say that, I understand that it's going to be per that bracket within that community, but are you going to, for example, inviting the media or doing something with that?
Nope,
this is more of an internal process.
This is really an internal process. And
because what you find out is going to be newsworthy.
Maybe we'll see, but that's not the purpose of doing it, nor do I want to use the information in that way. The purpose of doing it is really the engagement, and it's qualitative to couple with the quantitative data we have, right? So we know that in the census tract, this many people have diabetes. We already know that. So we're not asking, what's your diet? We're asking, how is it to live in this community with diabetes, right? And what is the way of being in your world? What are the barriers you have, and how does that experience go? Because that is part of the juice that gets us to have impact, is to find out what those barriers are and see if there's surgery we can do to help make that happen.
If you create a process like that that could be modeled and replicated throughout other counties, that would be priceless. I think that's the kind of information that no community knows how it's intangible until you can put those little focus pocket groups together to really get it. That's great that you guys are doing that.
Yeah, it's the social work has a tremendous history in understanding how to listen to communities, and not a lot of juice sometimes when it comes to galvanizing resources to implement those plans. So that's the other reason this role is very exciting to me, is to bring a true social science lens to this approach and complement what's happening in healthcare, because healthcare itself is so expensive and so draining to try to make work better. There's plenty of people doing that.
And it's partnering, it's community healthcare partnering to really meet those needs on.
Exactly.
I know you've not been here for a vastly long time, but have you had an opportunity to see what some of those needs or pluses where we're stronger, maybe in South Pinellas, St. Petersburg?
This is a fairly easy one to focus on because it's not only in St. Petersburg where this problem exists, but the attention to mental health and sort of the undergirding role it plays in all health outcomes, because there's a reality there that it's mysterious and it's scary and it's still stigmatized. And oddly, I still find that my HIV history has as much help to bring to bear to the mental health sector, because a lot of those same issues existed, right? So how do we normalize understanding that not everybody's mental health is the same, and that we have ways to address that? So there's lots of people who do different things. We take this federal grant, we put it on the ground, or we see a niche of elderly who need mental health screening for Alzheimer's, or we see children who might need to be screened for mental health services. And I actually got told this recently from a school board person who said, we stopped screening for mental health because there's nowhere to refer them. I always think that's the wrong place to stop, because you put pressure on a system when you say this many people, we should always figure out what needs are. But I understood the point. So I think mental health is one of those where the foundation's role may end up being a convening role. Let's bring in all the players and shine the light on this and try to figure out how to fund this in a way that is sustainable, but also has some real impact on
It's interesting
health.
because I've had conversations with a couple of other people in just different situations that mental health is one of those last frontiers that still has that stigma so much around it that people don't even know how to talk about it.
That's right.
There's just this lack of comfort in being able to, and if mental health is mentioned, then it's oh gosh, but not understanding that different diseases arise that are within that umbrella of mental health.
I would say, obesity is one of those that has a coupling with mental health. It's not always true, but it is often true.
And on the flip side, anorexia, bulimia.
Yeah, the opposite.
Absolutely.
Absolutely. So, diet, just to get a more global phrase, diet is certainly affected, but so is how you choose to live your life. And shame governs a lot of how people live, fear and shame. So, that's mental health. So, just to think about that.
Well, that's
I think
interesting.
matters,
We're going to have you back on to find out what you learn. So this is going to be an ongoing process, because you're talking 5 years. Wow.
Yeah.
Well, it's time to take another break, but thank you for kind of diving into that and letting us know where you're going.
Sure.
When we come back,
Yep.
it's time for our third segment, which is our Truth or Care.
Oh,
and
fun.
that is, what is important to you about philanthropy, your heart's definition of philanthropy, and why, where we got there. So we're going to take a break to thank our wonderful studio sponsor, the Nonprofit Leadership Center of Tampa Bay, and we'll be right back.
And now a word from our studio sponsor.
Hi, I'm Emily Benham, CEO of the Nonprofit Leadership Center, the studio sponsor for The Philanthropy Show. And I'd like to share a tip with you that can change your life. Do I have your attention? Good. Here's my story. I have been CEO of the wonderful Nonprofit Leadership Center for about 8 months now. I have met so many great people and learned so many things. My issue? How to keep track of all this information. I meet with a potential funder. We have a great conversation about important issues for them, and then I'm off to my next meeting. At that meeting, more exciting ideas and opportunities are discussed. It's all good, but sometimes by the time I get back to my office and sit down to capture this information at my computer, I may have forgotten some of the smaller but really important details. Other times, I found a great article on the internet, but I don't have time to read it, so I print it out. When I do have time to read it, can't find it. Does this sound familiar? My tip is one word: Evernote. It's a free productivity app that can be installed across multiple devices so that your information is always available when and where you need it. Now, I come out of a meeting, sit at my car for a minute, and type everything I can remember about the conversation at that moment into Evernote. It is incredibly liberating and helpful later when I need to follow up or meet with that individual again. To be clear, I don't pretend to be an expert on this app, but it totally works for me. Evernote. I hope you'll check it out. Thank you.
Welcome back to the Philanthropy Show, segment number 3, Truth or Care, with Randy Russell of the Foundation for Healthy St. Petersburg. And Randy, this is about, as we said before the break, the reason why. Now, you've been invested in the nonprofit community for quite some time. And you explained in the first segment a bit about your passion with HIV. But from this standpoint too, and maybe it's an expansion of your heart's definition of philanthropy, what does it mean to you? And the purpose, I'm going to say this in this show, because we often with the Philanthropy Show just go through Truth or Care, and I think that it's interesting to hear the person's perspective. But the reason Sharon and I developed the Philanthropy Show was to try to make philanthropy seen as something that everybody is connected to, right? And so thank you for letting me just say that really quickly. Sure. So what is your heart's definition of philanthropy?
You know, we're privileged to be able to be alive on this planet with means and resources. And one of the main things my parents taught us all was leave the planet a better place than you found it. And it's very clear to me that the use of that privilege is such an honor. It's so precious. Yeah. So there's a passion that happens for me when I see the way in which we're sometimes thoughtless about how we approach the world, and I don't mean us individually, I mean our systems. And so, politics get in the way of caring for one another, like, the states that are struggling with Medicaid expansion now. I look to and say, so really what you're saying, let's articulate the other side. You think poor people don't deserve health care. Because that's the other pronouncement that's being made. It's all wrapped up in an economic bubble. So I love finding ways to help people see there's this opportunity and privilege of using the resources we've been given to benefit others. And I think that's one of my life's purposes is to be of benefit. So.
I like that. And what you're describing, what I'm hearing is, instead of having all these compartments of people, and we talked about this a little bit in the show, these labels that we will have of I do this for a living, or I earn this, or I make this amount, or I'm in this quadrant, or I'm schooled or unschooled, all these different factions that separate us. But the nonprofit community can pull that together as well and eliminate that so that we're just the one.
Very much so. There's a mindset that that others have brought me to, which is inclusive of that individual passion, but really understanding that community leadership starts with understanding yourself. It sounds a little bit selfish, but really what goes on for you, watch your behavior, what are you choosing? We are choosing stuff that is about your own privilege. That didn't help anybody. So how do you live out loud with your leadership and your principles? Well, you dedicate yourself and you commit, right? So there's that part of this that, many people inspire me daily who I look at. The whole pay it forward concept. really appeals to me. Just being nice to 3 people a day.
You're speaking Sharon's language now.
Just being nice to
That's-
3 people a day,
absolutely.
and that can help change the world. I really believe that. So it is a great opportunity. This role is, and it is a real privilege to serve in it.
And I want to share this too, that you're a meditation guide for the Shambhala Buddhist community.
Yeah.
I think that's fascinating.
Yeah.
When did you become involved with that?
So I started sort of casually going to programs in the early 2000s, and then I went on a month-long retreat. And in the middle of that retreat, there was no question that taking refuge and becoming Buddhist was what I'm here in part to do. And that daily meditation is my way of connecting with that part of myself that has this purpose of being of benefit.
Oh, that's great. Wow. You're multifaceted. It's
Aren't we
wonderful.
all?
Yes,
Isn't everybody?
Yes,
It's
this
true.
is true. But
Yeah.
thank you so much for coming on the show. Really
you.
loved having you, Randy.
Thank you
Welcome
so
to
much.
Tampa Bay.
Thank you. I'm delighted
Welcome
to be
to
here.
the Foundation for a Healthy St. Petersburg.
Thank you very much.
And we look forward to, like I said, I'm curious now. I want to know what you're going to find out.
Me too.
So exactly, we have to come back. That does it for today's The Philanthropy Show. We'll be back again next Monday at 4 with an all-new show. And in the meantime, be sure to check out our past shows on the Past Shows tab. Have a great week.
Do you have an idea for The Philanthropy Show? Contact us via our website or email us at tps@myvideovoice.com.